to yes. Hello, welcome back to the O.M.A Medical Studio. Yeah, this episode is going to be interesting. You get me? I mean, look at gestational age and then estimated date of delivery. Well, we are going to learn how to calculate for the gestational age and also estimated date of delivery, especially in what the pregnant women. But this particular video is basically to both gender, male and then female, specifically the male who basically deny pregnancies, thinking that the time we met is basically shorter than the number of days your scan is telling you that you have been pregnant for. So maybe if you've had an encounter with a person for like some weeks, maybe 3 weeks, or yeah, 3 weeks or something. The person goes to take a scan and the pregnancy is like 4 weeks old or 5 weeks old. And you basically deny it. No, it's not me. I mean, the last time we had this thing, you get it. I mean, yes, that's what we are going to tackle today. Now we are going to clear doubts. And if you find yourself in that bracket outside or that bracket of doubt, if you find yourself outside of it, and it basically means you need to go and make arrangement to accept whatever thing you were rejecting. So basically it's to both genders and also to the females who would basically have multiple partners, probably has had encounter with few of them, basically gotten pregnant, and then she doesn't even know who that pregnancy is for. But then olden days, I mean, or the past days, our old people have a saying that goes like, it's only the woman that knows the person that got her pregnant, which I don't know how true this is though. But then, yes, this is going to basically clear some of the doubts we've been having as males and what females as well. All right, gestational age calculation and what estimated date of delivery. And before we get into it, we've basically spoken about the normal menstruation, we've spoken about the free period, we've spoken about some abnormalities concerning menstrual cycle. That's basically the dysmenorrhea and then other things. We have more things to talk about on that aspect. Today, I just want to chip in this particular thing because I mean, this little thing you see on the board can cause a whole lot of what havoc. I mean, people have been victims where you don't even know who to give the pregnancy to. Or basically, some people or some men try to reject the pregnancy because they feel like it's not for them. The number of weeks the scan is saying you are pregnant is basically not within the weeks or within the times I had this encounter with you. Yes, people have been saying that. You will get into it. So, I mean, this is to everyone. We all need to get to know this. All right. So, when you come to the board, we have what we call what trimesters. Now, pregnancy is divided into stages. We have the first trimester, the second trimester, and then the third trimester. Some few books will have different um, number of weeks and things as per the trimester. Sometimes depending on the continent or the country too, you can have what differences in them. But then when you come to our side, the first trimester is basically from your last menstrual period to what the first 12 weeks, and the second trimester begins from the 13 weeks to 26 weeks, where the third trimester begins from the 27 weeks to the what 27th week to the 40th week. That's basically what the categories, that's the divisions. I mean, just to chip in this, the most dangerous part of this trimesters is the first trimester. That is where everything is orchestrated. How the baby is going to look like, the baby is going to form, everything is orchestrated from there. So if there's going to be an abnormality in pregnancy, basically it's going to occur at that point. Then from this side, that is where the growth begins. So the head forms like something else. The head is just going to keep on developing from the second trimester and then subsequently become a normal head. Yeah, so basically these are what the divisions or the categories of what um, pregnancy progression. All right, so let's take one. Like I said, I was trying to address the fact that people go on, they have an encounter and then they miss their period without knowing their free period and thing. They have an encounter, they miss their period, and then they go on to do a pregnancy test. Now, normally when the red lines becomes two on the kids, you are scared. Basically, you are not expecting it. Yeah, so you get scared. Or people as some people are expecting it, so they become happy. But the number of people who become scared are more than the number of people who become happy. Yeah, basically because we are not expecting in this particular economy. You understand? All right. So yes, the age of pregnancies you see on scans. Normally, if the scan, it depends on where It depends on the time the scan was taken. You understand? Pregnancy, a scan, the first scan taken after 22 weeks or something cannot be well reliable when it comes to dating. Now, the moment, if you're a female, the moment you test, you miss your period or you suspect that you may be pregnant or you might be pregnant, and you do the urine test kit test and it's positive, the next thing you need to do is basically go on to take a scan. Now, the scan you are going to take is not basically for the fact that you are like you want to know the date or something. One of the very peculiar things we advise that when you test positive for pregnancy, you should do a scan is what for confirmation. Is the only way to confirm pregnancy. Now, people take it for granted, and then once they do the urine test and it's positive, they go on. If they don't want the pregnancy, they go on to take all kinds of medications with the mindset of what aborting or terminating the suspected pregnancy, or yes, the suspected pregnancy they've tested positive for. That is not the way to go. If you test, there have been so many people. I mean, the test can be human error. You understand? Moreover, you are not even a lab technician. You do the test, it's positive. The next thing you're supposed to do is probably go for confirmation. You can go and do the test at a very professional place, or yes, a clinic or a hospital. Let them do it for you to confirm that. When you do confirm that with another test, go on to do a scan, a pelvic scan, to see that yes, is a pregnancy there or not. But there have been so many times people have tested positive for pregnancy using the test kit, and basically the scan shows nothing there. It could be human error, it could be anything. It could be that the pregnancy has not even gotten to the point the scan can visualize it. You get it? So one of the first things we need to do is what? To take a scan when we test positive for that. Again, that is what for confirmation. And also for dating, the earlier you take the scan, the more reliable the dating of the pregnancy is. So if you take the scan late, the dating, I mean, we'll talk about, we'll basically get to a point where we are going to talk about the discrepancies in dating a pregnancy, depending on the time the scan was taken. You understand? So we'll talk about that. But one of the few things I would like to let us know is that the earlier the scan is taken, the more reliable the dating of the pregnancy is. Okay, so let's say without a scan, you go on, you test positive for the for pregnancy using the urine test kit, you test positive for it, and you want to estimate the age of your pregnancy. Maybe, just maybe, you have multiple people. You basically want to kind of um, know who is responsible. But again, maybe the person responsible is trying to deny. So you want to know that particular time or the particular, you want to estimate the age of what you are carrying or what you suspect you are carrying without the scan. Right? Or basically, maybe you don't even trust the scan. The dating on the scan, you don't trust it. Maybe it could be due to the time you took the scan or where you took it or anything. So basically, let's get into it. Right, so let's take the gestational age first. So just maybe you you have tested positive for pregnancy using the urine test kit, and you want to know. The first thing you need to do is what you need to know your last menstrual period. So you need to know this. Excuse me. Yes. All right. So yes, you need to know this. You need to know your last menstrual period. So here you get it. Let's get to this side of the board first. Estimated date of delivery. Yes, we will come to that side. Estimated gestational age. First, subtract the days of your last menstrual period from the number of days of the same of that same month. So maybe let's take it from here. So maybe your last menstrual period, you're in 2025, right? Your last menstrual period was in maybe January, 6th January, 6th January 2025. That's supposed to be your last menstrual period. And yes, you missed your menses in, let's say February, you missed your menses in February. So basically, in March, you went to do a test and you found out that you were positive. So let's say in March, you tested positive for pregnancy in, let's say, 6th March. 6th March. That's where you tested positive for pregnancy. You did a self-test and it came positive. Now you want to estimate the age of your pregnancy or the age of your suspected pregnancy. Like I said, the only way to confirm pregnancy is basically doing what? A pelvic scan. That is the only way to confirm. Another positive thing why we need to do a scan is basically to even know the location of the pregnancy, whether it's in the uterus, whether it's outside the uterus. Most people tend to have ectopic pregnancies and then they lose their life just because they messed up. They didn't take the scan. They just went straight ahead trying to abort the baby they haven't even seen. They are just suspecting. They are just aborting a suspected baby. They haven't even confirmed it. And they go and take all kinds of concussions and then it messes up everything. So, like I'll keep on saying, the first thing you need to do after testing positive is basically going to do a scan. That is it. There is no other way for that. Okay. So you test positive on the 6th of March 2025. Then you want to estimate the age of your pregnancy. Now, if you note your last menstrual cycle, you are going to take the first day of your last menstrual cycle, the first day of your last normal menstrual cycle, menstrual period. So if the first day was 6th of January, the first day was 6th of January, the first day of your last menstrual cycle was 6th of January, 6th January 2025. So what we are going to do is that we are going to, January is how many days? 30 days as September, April, June, and November. All the rest are 31. Okay, so January is 31 days. It's a very long month. 31. We are going to subtract 6 from 31. 6 from 31. If you take 6 from 31, basically what are we going to have? We're going to have like how many days? We're going to have 25 days, right? So it's minus 6. We are going to have 25 days. Then we are going to list down the number of months up to 6th March. So January, we have what? February, and then we have what? March. February is how many days? 28 days. And then March is how many days? 31 days. March is also 31 days. So what we are going to do is that now after knowing that we have 25 days here, this is the gestational age we are calculating. This is a very simple way we used to calculate it. So just list the month up to the day you did the pregnancy test. You tested positive on the 6th of March. So just list it up there. Your last menstrual cycle you had, the last menstrual cycle you had was what? 6th January. So from 6th January to the day you tested positive for, which is what? 6th March. So we are here. 6th March. So this is what we are going to do. So now we have what? 28 days from January. We subtracted the 6 from it. So we have 25 days from it. Then February is what? We are going to divide all of these things into weeks. February is 28 days. If you convert the 28 days into weeks, you are going to have what? 4 weeks. 4 weeks, 0 days. Then March. You have how many days in March? March is what? 31. But remember that you didn't wait till 31st March before you did the test. You did the test on the 6th of March. So you forget about the rest of the days on March and what land on the 6th. So within the 6th day of March, 6 days. Within the 6th day of March, that was when you did the test. So this is what you are going to do. Now we have what? How many weeks? When we come to the week side, we have what? 4 weeks. Then the number of days we have here, we have what? From here, we have 25 days, 0 days, and what? 6 days. 6 plus 25 is what? 31 days. 31 days. Let's convert 31 days into weeks. We convert 31 days into weeks. Basically, we are going to have what? 4 weeks, 3 days. Yes, 4 weeks, 3 days. A week is 7 days. So 7 times 4 is basically 28. 28 plus 3 is 31. So 4 weeks for 3 days. Then we are going to have these 4 weeks in addition to, so we are going to add this 4 weeks plus this, another 4 weeks. So that is what? That is going to be 8 weeks, 3 days. 8 weeks, 3 days. So 4 weeks plus 4 weeks is what? 8 weeks plus what? 3 days. So your pregnancy, your estimated gestational age of the pregnancy you tested on the 6th of March is going to be what? 8 weeks plus 3 days. If the scan is given you, depending on the day you took the scan on or on the date or Yes, we took the scan. You're going to have discrepancies, but it's not going to be anything far away from this. Understand? It's never going to be anything far away from this. So if you had your last menstrual cycle at this days, and then you tested positive at this date, and you basically haven't done the scan yet, you could estimate the age of your pregnancy. Now, one thing is that don't ever assume that if you have an encounter with anyone, if you probably had an unprotected sex with anyone, and basically the person tests positive for pregnancy, and then the person takes a scan and it gives you an average days of this. Maybe within this particular period, you never met the person. Probably you didn't sit genuine, you never had any encounter with the person. Maybe you had an encounter with the person from like the 14th or 15th or the 20th of January there. You understand? Without knowing the person's cycle length and safe period and all of that. You had the encounter with the person. Note that the age of that pregnancy is not going to be calculated from that your time you think you met the person. No, that's not how it works. I met you on this particular day, so the pregnancy should be fixed on that day. You don't determine that. The system determines that. So basically, you have no like um, yeah, hello. Good evening. Mama for back one. So so basically, don't think like you're the pregnancy should be calculated on the day you met the person. You can't cheat the system. The age is calculated basically from the first day of the last menstrual period of the person. So she had the last menstrual period. He started on the 6th of January and she tested positive on the 6th of March. After she missed the period in February, but probably she didn't care. So she tested positive on this side. And basically, when you calculate that, you're basically going to have 8 weeks, 3 days old what pregnancy. That's an estimation. Okay, so we can take another example and then do that. Okay, so let's take another example. Let's take someone having so we are in April, right? So let's take the person had a last menstrual period on the 20th of January, or yes, 20th of January 2025, and then tested positive for pregnancy, LMP, tested positive for pregnancy on the, let's say, on the 5th of April, on the 5th of April 2025. Now I want to know the estimated gestational age of this particular person. All right, so like I said, we list down the months. So we have January, we have what? February, March, we have what? April. So January is how many days? January is 31 days, February is 28 days, March is what? 31 days, April is what? 30 days. All right. So we are going to convert this into weeks, right? But note that the person had the last menstrual period from the 20th of January. So we take 20 out of the January, 20 days out of the January. 20 days, we are going to have what? If we take 20 days out of 20, 31, we are going to have what? 11 days. So you are going to convert this into weeks and days. Weeks and days. So if you take this one out, you are going to have what? 11 days. You take the 20, 31 minus 20, you are going to have 11 days. And here, if you convert 28 days into weeks, you are going to have what? 4 weeks, 0 days. Then here too, you convert into the weeks, you are going to have what? 4 weeks, 3 days. If you convert 30 days into weeks, you are going to have 4 weeks, 2 days. But when you come to April, the person did the test on the 5th of April. So we just need the 5 days, the first 5 days within April. That's all we need. So we don't need the weeks in April because that's the time we did the test. So we just subtract the number of days. We just subtract the number of days taken for us for the person to do the test from the whole number of days in April. So since the person did the test on the 5th of April, that's the only thing we need. 5 days. So now we have about how many weeks? We have 8 weeks here. We have 8 weeks here. 4 weeks plus 4 weeks. That's what? 8 weeks. How many days do you have here? You have 11 plus 3. That is what? 14 plus 5. That is what? 19. We are converting 19 days into weeks. What are we going to get? So 7. You understand? So 7 days makes a week. So we are going to get like 2 weeks. That's 14. 2 weeks, how many days? 2 weeks, 5 days. So we are going to add the 2 weeks, 5 days to this, to the 8 weeks. 2 weeks. So that's like what? 10 weeks. So that's like 10 weeks plus 5 days old pregnancy. Yes. So yes, so if the person had a last menstrual cycle or period on the 20th of January and then tested positive on the 5th of April, we lays down the month, we subtract the number of days taken for her to have taken the number of days, her last menstrual period, the number of days taken for her last menstrual period to occur. That was like 20 days in January for her to see her cycle. So we take the 20 days from January and we have what, 11 days. Then we convert the rest of the month she took in waiting, the rest of the month she took in testing positive for the pregnancy into weeks. So February, we convert February into weeks, we convert the number of days in March into weeks, and then we take the number of days which she decided that no, today I need to do the test from the days, the same days of the month. So it took her 5 days in April to realize that no, I need to do the test. She did the test and it was positive. So we take that 5 days from the April and we are going to have what? Take 5 days of the April out. We throw the rest of the days in April out because it took her only 5 days to realize that. Then we add it up to the number of days from her last menstrual period. Then we get our estimated gestational age. So yeah, thank you. This is O.M.A Medical Studio. And next one is going to be based on what? How to calculate for the estimated date of what? Delivery, the EDOD, or sometimes in short EDD, the estimated date of delivery. That's going to be our next video. So stay tuned. This is O.M.A Medical Studio. I hope you understood it. Basically, I'm sure now some of the men are going to understand the women, and the women are also going to understand the men.